Today we have Riley, who's come in with a bit of low back pain after training for his Torian Pro semi-finals CrossFit games. It's coming up in 3 weeks, so he needs to get on top of his back injury. So today we're going to use this opportunity to show you guys my 3 favorite areas to treat for lumbar disc injury, which he's actually had a history of. So the first area we're going to treat is actually the back itself, and the muscle being the quadratus lumborum, or QL. And my favorite way to get into this is with active release technique. So Riley, what you're going to do, your leg's going to sweep down and your arm will reach over the top of the head as we work into this muscle. And for most people, when you have a disc injury, this is the muscle that really spasms up and creates all that tension, limiting that sort of range of motion and twisting and bending forward. So it's crucial to take the pressure off this one, just to allow you to move a little bit more comfortably. Good. And I find the active release technique of sort of working into the tissue while at the same time using the body to stretch the muscle, it's a game changer. It just allows that extra movement so quickly, but it can be a little uncomfortable for the patient. Hey, Riley?
Yeah.
Let's go a couple more passes in there. Good. And one more. Perfect. Now, the other key muscle that I always like to treat with lumbar disc injuries is the erector spinae, which sort of runs up each side of the spine. But I'll do this actually getting Riley to sit up facing that window there, and give yourself a big hug for this one. So for this, we start with the muscle sort of in its shortened position, upright like this. We hook in, create tension at that point, and just stretching the muscle by sort of letting him relax forward like that. Now, luckily, Riley's disc isn't herniated. It's just the annular fibres are a little bit irritated, and so he can actually bend forward a little bit. Whereas if you had a really nasty disc bulge, we'd probably just do more basic soft tissue work, massage through this muscle, because we wouldn't want to irritate his symptoms by flexing him forward and sort of forcing that disc bulge to go back into the spinal canal. Good. Let's go a couple more passes. All right. Now, so they're the 2 key muscles in the back that we've got to change. The next sort of area is the hip. So through the glutes, the piriformis, that'll all seize up with this sort of injury. So again, let's get you laying on your side facing away from me. So the first muscle that we'll treat is sort of the muscular tendinous point of the glute medius, which comes up high on the iliac crest here and sort of crosses all this area, and it will seize up to try to stabilize that lumbar pelvic girdle. So to do this, we'll take that tension sort of down the leg, and Riley, you're going to bend that knee up towards your chest and tuck it in. And yeah, there's a lot of tension there. You can feel it's really sort of ropey and bandy through there. And again, it's not comfortable for Riley either. You can see. Good, let's go again. But this muscle is often overlooked when treating disc injuries, because some people will really focus on the back itself. And by not treating this, you know, the muscle will stay spasmed up and actually becomes weak over time as well. And they lose the hip stability, which can be a big player in, you know, ending up with chronic back pain because their glutes aren't stabilizing their hips correctly, their back compensates, and then it continually irritates, and you get that reoccurrence of disc bulges as a result. Good. So now just below that glute medius, we've got the piriformis muscle, which comes off the greater trochanter, the top of the femur here, and then across like this. So to do this, we kind of take the patient through a pigeon pose from yoga, stretch it at the same time as working into that muscle with another active release sort of technique move here. I'll just go one more pass through there. Good. Now, finally, so we've got the glutes, the piriformis. Now we need to hit the TFL as well. So this one, Riley, you're going to help me again with the motion. Let's start with your leg here. I might even get you to hold on to balance yourself. It'll straighten and drop down and back like that, okay? Hold there. Let's go. Perfect. Come back up. And again. And similar to the glute medius, the TFL will have a huge role in sort of stabilizing the hip. And one more time there. Good. So now that we've taken off the pressure from the low back, from the back of the hip there, next key one is the hip flexors, because they're the three muscles that will, for hip flexors, QL, glutes, they will sort of really seize up when you have that injury. So similar to what we were just doing, Riley, let's leave that hand over the top of your head. Your leg's going to go straight in line with your body, and then the whole leg comes backwards, okay? Yeah. Here we go. All the way. Good. That's pretty nasty in there. Have you had some hip issues previously to blowing this up?
Yeah.
Yeah, you can feel this is probably the worst out of all of them for you. And I would say this is probably the precursor to the disc injury. Something was going on in this hip. Let's go there and back. Good. Two more. Good. Last one through that. Yep. Great. Now let's lay you on your back. Because I could feel that was so horrific, I'm going to hit another key muscle in there called your pectineus. All right, so for this one, digging into the front of the hip there, sorry mate, drop the hip out, and then we're going to rotate this one again. And this will sort of just help with his mobility of that hip, allow a bit better range of motion, and allow everything to sort of function correctly, which should stop all that compensation through the back and allow him to get back to training without irritating that disc. Good. One more. Great. Now they're the three sort of key areas in terms of muscles that I like to treat. Now, because he's got an active disc injury, I'm going to show you one more thing that I think is a game changer for fixing disc injuries and reducing pain, and that's electroacupuncture. So Riley, let's go face down for this next one. All right, so what we're going to do is get 6 needles in. So through those erector spinae to start with, and then we'll also hit the QLs, those main muscles I was talking about that sort of really jam up with any disc injury. So, now I generally find this a lot more comfortable than the active release technique. It's just really that sort of pinch as it goes into the skin, and once it's in there, might get like a little bit of a dull ache, but otherwise it's not too bad. So that's all the erector spinae sort of looked after. Now we'll go into that QL. Get one on the other side too. Oi, bit of a twitch there. All right, so now we're going to hook it up to the electroacupuncture. And the key with this is we're going to run a current from this one to this one and then the opposite way there, and that'll sort of target the disc in between. So as a patient, how this actually feels is it's just like a light sort of pulsing feeling. It's generally not too painful. I'm just sort of slowly turning up one of those channels now. And Riley, you let me know when you feel that there. Yeah. And we can see that sort of just twitching on the muscle, but that's not uncomfortable. You cool with that? Cool. Now let's get the other channel as well. We're going to sort of bring it up to that same intensity. All right, so you let me know when you can starting to feel that. Yeah. Have you got that other channel going now? Yeah. Cool. We can see that just sort of ticking away. So what that does is, by compressing and relaxing, contracting, relaxing the muscle, it almost acts like a little bit of a pump. So for that inflammation, and to also increase blood flow to the area. So we can use that in an acute injury setting like this, where he's just tweaked his back. But sometimes with people who have long-term back pain and they have this sensitivity through their nervous system, you can make it so that pulse, so right now it's like tick, 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 you can really increase the frequency of that. So it's like bang, 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 and it actually decreases the sensitivity of the nervous system and can act like anesthetic in a way. All right, so now that you've seen how I like to manage the pain with disc injuries, I've got another video which I'm going to link to you guys about hip and how we really get into that, and especially pain with squatting. And if you've liked this so far, it'd be great if you guys could subscribe and support me, and I can bring more videos your way. See you next time.